Hi, I'm Heather and welcome to today's episode of Life's On with Manipal Hospitals. Did you know that strokes are one of the leading causes of disability among adults worldwide? Think about it. One moment you're having a normal, healthy day. The next, a part of your brain begins to fail. You can lose your vision, your speech, or any number of bodily functions that are controlled by the brain. Yes, strokes are devastating, yet many are unaware of the signs and symptoms to look out for, or the fact that timely medical intervention can make all the difference in the world. To shed more light on this, therefore, we have with us today Dr. Safal Shetty, a consultant neurologist at Manipal Hospitals, Goa, who specializes in stroke, neuroinfection, headache, and autoimmune neurological disorders. Dr. Shetty will tell us all about stroke, the signs and symptoms, warning signs, risk factors, stroke mimics that pose major diagnostic challenges, and most important of all, prevention. Hello, doctor. Welcome to the show.
Thank you.
So, doctor, when usually when we hear people talking about stroke, they often refer to a heart attack. What exactly is a brain stroke?
As you mentioned, it's basically something like brain attack. Like how people perceive heart attack, it should be perceived in a similar way as brain attack. Stroke is a scientific terminology. However, for laymen, for public, it's better to call it as brain attack. Even when we discuss it with patients, when we tell them the diagnosis that it's a stroke, they don't seem to understand it. But when we tell them about brain attack, they seem to perceive it better. And
So, what exactly is a stroke? I mean, how does it occur?
basically, there is blood vessels which carry the oxygenated blood or the pure blood from the heart to the brain.
Okay.
Whenever there is a block in the vessel, it causes loss of blood supply, or oxygenated blood from the heart does not reach the brain, causing loss of function, or that part of the brain gets damaged, causing stroke. And that manifests in the patient as loss of function mostly in the form of one side weakness, or loss of vision, or loss of balance, or deviation of angle of mouth to one side, or even in the form of difficulty in speaking. So these are the common manifestations of stroke.
So now, would I be able to feel a stroke coming on, considering that timely medical intervention is key and can make all the difference in the world? What are the signs and symptoms, the early signs and symptoms that,
Which we can expect.
Yes.
Is usually the stroke is sudden onset. So we can have warning symptoms like a week or 3 or 4 days before the onset of the stroke, in a similar fashion as weakness of one side of the body, which lasts for hardly few minutes and it improves by itself. In any other manifestations I told earlier. So these are the warning symptoms which are there, and when they are there, it has to be picked up and they need to get medical attention. Unlike heart attack, which comes with pain, these symptoms do not have pain, so patients tend to ignore it, thinking it may be because of change in temperature or change in their diet, or they didn't get sleep well the previous night. So they may think like that and ignore it. But that needs to be taken seriously, and we have to get medical attention for those symptoms.
So if you say weakness on one side and all, like you said, there are many other things that could manifest the same symptoms. So, is this what doctors call stroke mimics? I mean,
Not really. Stroke mimics are in different types. They all manifest as some similar manifestations what we told, but the diagnosis is not stroke, it is something else. For example, a patient might have seizure also, and when no one is seeing him, he would have had a seizure or fits, and when someone notices him, he is lying on the bed with one side weak, which can occur in seizures also or in fits. So they may confuse it as stroke and bring him to medical attention. But that time we'll have to
so this is where the doctors come in.
This is where the doctors come in, and when they're brought to medical attention, we need to be careful that this is not a stroke, it's a seizure, so we need to be careful. Similarly, another condition is when there's low sugars.
Okay.
They also can manifest as something like stroke. Like they also can have loss of consciousness, they can have loss of balance. So we need to be careful and then rule stroke out and treat the condition appropriately.
Now, when you say, loss of one side, drooping and all of this, this is also one of the manifestations of high diabetes. Is there a correlation between the two?
There is. Diabetes is a risk factor. It's an important risk factor for stroke. But having drooping or loss of one side of the body does not happen in diabetes per se. But diabetes causing high blood sugars can cause seizures. At that point of time, they can have one side weakness, and it is well known.
So, doctor, how common is stroke, considering we live in a chronic and persistent state of anxiety in a modern day world? Are incidences of stroke on the rise?
Definitely yes. If I have to quote, the global burden has definitely increased by around 26% from 1990 to 2000.
Okay.
There were around 4.5 million deaths from stroke all over the world. By 2000, it was 5.6 million.
Okay.
So definitely there is increase. Reason for increase is diabetes is being picked up.
Which is one of the lifestyle.
Yes. Obesity. A lot of people are getting attention, medical attention, which is improving.
Okay.
So it is definitely on the rise.
So basically what you're saying is that it's all of these lifestyle diseases that have a direct effect on.
Yes, they do have. Our country is supposed to be the diabetes capital of the world.
True.
So we are seeing a lot of patients coming with young diabetes, as in patients who are at 30, 35, 40 who are getting diabetes. So along with diabetes, there is hypertension,
True.
cigarette smoking, obesity because of sedentary lifestyle, and also alcohol consumption. These are all the risk factors which are there, which can be tackled, and we can actually prevent stroke if all these are tackled.
So would you say that, exercise and a more active lifestyle will not only help reduce all of this, but also help reduce your chances of stroke?
Definitely, yes. Exercise does take care of your diabetes, of your hypertension, and of your obesity. So all these, when it's taken care, definitely the chance of having a stroke decreases substantially. Yes, I totally agree with it.
Are there any other risk factors?
There is genetic factor also, but we don't see it in patients who have stroke at their elderly age.
Okay.
So, or at 60, 70, we don't see them with the genetic problems. Genetic factor comes into play when they have stroke at young age. It's around 25, 30. It is known that strokes can happen at a young age also. And they'll have one of their family members having stroke at a young age. At the elderly age group, we do not really think of genetic.
It's got nothing to do with hereditary?
It has. But those set of patients who have got stroke at a young age.
Have got a whole other...
Yes.
Okay. So now, doctor, if you say that, suppose, say somebody in their 20s has got a stroke, what are the things that a patient like this needs to do to prevent future occurrence?
One is, again, we have to see the cause of the stroke. If it is because of a heart disease, which is common in India, something called rheumatic heart disease, because the heart is not functioning properly because of a childhood infection, and that can precipitate a stroke later on in their life. If that is there, that needs to be taken care of. If we do not find any cause of it, then we dwell into genetic causes, provided they have a family member who's had a stroke at the young age. Young patients usually with stroke, these are the causes. Heart condition.
Is there any anything that patients like this need to do to lower their chances of future occurrences?
Definitely, they can take care of all the other modifiable risk factors, which I told, as in they should be active physically, they should make sure they eat healthy, not to eat any fried items.
Okay.
Eat vegetables and not to eat a lot of saturated fats, what they say. So,
And all of the other vices, alcohol, smoking.
Yeah, definitely. That's obvious.
So now, I believe, like you said, a majority of strokes are preventable, considering how debilitating and life-threatening a stroke can be. Is it true that, you can prevent occurrence? Not just lower risk, but
yes.
prevent occurrence?
Prevention is better than cure always. But I would not say that we can prevent it completely, because there is something called a non-modifiable risk factor, that is age.
Okay.
With progressing age, the risk of person having a stroke becomes higher. So I cannot tell it can be prevented totally, but risk can be minimized.
And what is the line of treatment? Like, since it's a question of you have that time factor involved. So what is the line of treatment within that time factor or after that, once you cross,
First of all, when the patient comes, we have to make sure it is stroke and it is not those stroke mimics we discussed some time back. So once it is diagnosed, the first thing patient has to get is a CT scan.
Okay.
Or an MRI. So with the CT scan, we get to know whether it is there is a stroke. If it is a stroke, whether it is bleeding in the brain or it is clotting in the brain. These are the two terms which we use to make people understand. If it's a bleeding in the brain, there is no specific treatment.
All right.
If there's a clotting in the brain and the patient has come within 4.5 hours after the onset.
So that is the magic.
Yes. So within 4.5 hours. That is when we come into saying that this can be treated with an injection.
Now, 4.5 hours from the appearance of the first symptom?
Yes, from the onset. So onset becomes very, very important. If you're not aware of the onset, we take as last seen normal. Suppose someone wakes up with these symptoms.
Yes.
So last seen normal will be the previous night. So that will be taken as onset. Then definitely the 4.5 hours has crossed.
Yes.
Then we have other line of treatment. Again, that depends on the evaluation we do. We can do further evaluation in the form of vascular imaging, where we do the scanning of the vessels.
Okay.
And there are other modalities which we can do, and we can do something called endovascular treatment. Not injection, it's an endovascular therapy, like to put it like stenting, what we do for cardiac patients.
This is invasive.
It's an invasive procedure. So that can be done. But again, that has a lot of discussions and a lot of technical aspects to it. But this 4.5 hours is a very strict guideline protocol.
So, doctor, suppose a patient comes to you within 4.5 hours. Now, can you, how much of, what do you say, how much of treatment would help the patient come back to normal, or is it?
To put it in a simple way, the injection will make the patient improve if he had very minimal symptoms.
Okay.
So we plot a score and we classify the particular stroke into a mild one or a severe one.
All right.
If it's a mild one, injection definitely has a role.
Okay.
If it's a major one, the chance of him coming back to near normal is less.
Reduced.
But better to treat than not to treat.
So, doctor, is there anything that patients can do to help in their own post-stroke rehabilitation? Yes,
definitely they can. What we do when the patient gets admitted is physiotherapy.
Okay.
It is done by a neurophysiotherapist who has specialized in neurophysiotherapy.
Okay.
So they teach them certain exercises depending on the patient's condition. Suppose patient has loss of balance, they do something called gait and balance training.
Okay.
Suppose patient has weakness on one side, they give strengthening exercises to that particular part of the body. And patient, when they are not doing this, supposing when they are just being there, they can do themselves.
Once they go home.
Once they go home or in the hospital itself, they can use their normal part to lift the abnormal side or the paralyzed side.
Okay.
They can, for the upper limb. For the lower limb, they can keep the paralyzed side on top of the normal side, as in the leg,
Yes.
and keep moving it, so that there is some sense of movement in the paralyzed side. So
Okay.
there is,
So basically get your muscles up and
Yes,
moving again.
yes, so that the earlier you do, the more you do, the better you get. The role of physiotherapy is that if you have to do it at the initial time itself.
Okay.
Do not expect physiotherapy or the exercises to make wonders or improve the patient after 1 year, 1.5 years of stroke. So it is very important for the patient to understand the fact that it has to be done. If not done, it can cause a lot of problems in the form of stiffening of that particular paralyzed side.
Okay.
And once that occurs,
Then
then it's difficult to move the limb itself, and the limb will have a lot of pain when it's moved.
okay.
So that's
Now
how the
this
important
is
it is.
all the physical rehabilitation. Is there also a mental rehabilitation involved?
Yes, there is. That is mainly for speech, language, where there is this mental rehabilitation comes into play.
Okay.
Whenever they have a difficulty in language or speech problems, like they have difficulty in finding a word, they won't be able to tell the name of the relatives or name of an object. That's when the mental rehabilitation comes into play.
Okay.
So that is one. Again, it's all tailor-made. So patient,
Depending on the severity of
depending on the severity and depending on the symptom, what the patient has.
Okay.
Some of them will have only limb weakness, but they will be able to speak normally. Some of them will have only speaking problem, but they will be able to walk
The
and
physical,
talk.
yes.
Walk. So when there is speech problem, you'll have to use only that.
Okay.
So that's how it goes.
Now, once the patient go home, it's, besides the healthcare provider, which is the doctors and the physicians, caregivers at home play a huge role
Definitely.
in rehabilitation and in bringing the patient back to normal. So, what would you advise me to such caregivers who are involved in taking care of such stroke with patients?
The caregiver's role starts from the hospital itself. When the physiotherapy is being done
Okay.
in the center, the caregivers are supposed to learn them and do the same at home. And they have to be always motivating to the patient that they're supposed to do it on a regular basis. And I agree it becomes difficult because to nurse a patient on a daily basis,
Back
it
to
becomes really
health,
difficult.
yes.
But they should not lose hope, because they have to do it at the earliest, and they have to do it at those initial few months. That's when you see the difference.
Okay.
So their role starts from the hospital, and it has to be continued from hospital and to the house as well. So, and during this period of caregiving, they might have something called a caregiver burnout, where they get stressed because
Yes.
of this. So they can take help from a psychiatrist if required, after discussing with the treating neurologist regarding their problems.
Okay.
So we need to take care of them as well, because if we take care of the caregiver, then the patient whom you're treating becomes better.
True.
So that is one thing which we all tend to ignore, or we do not really bother about it,
The
because
caregiver.
we are only
yes.
thinking about
the patient. Yes.
So this comes into a lot of role in our neurological disorders. So it can be stroke, it can be dementia, all these neurodegenerative cases.
Yes.
Caregivers have a lot of role to play in.
What about the primary physician?
Primary physicians are the ones who will be seeing the patient at the first. Patients won't straight away come to the
To a
neurologist
hospital,
or a tertiary
yes.
care center. So primary physicians most of them are aware of it. I would suggest they should make the patients aware whenever they're treating a diabetes or hypertension.
Okay.
They should tell the patient that, look, you have to be serious on your medications and follow as per the advice given by me. Otherwise, you can have a stroke or a heart attack.
Okay.
So this is their role, to sensitize the patient that this can happen.
Also make them aware of the signs and symptoms to
Correct.
look out for.
So there is something called stroke awareness in the form of Be Fast.
okay.
BEFAST. Be
Alright,
fast.
Be fast.
So B for balance, E for eyes,
Okay.
F for face, A for arm, S for speech, T for time.
All right.
Time is equal to brain. So if patient has B loss of balance, loss of vision for eyes, face if it's a drooping, if there's
Okay.
arm weakness A, and S is difficulty in speech. These are all the indicators of stroke. So whenever anyone has this problem, they have to go and seek medical attention, and this board can be put in their clinics. So whoever comes into the clinic, outside the clinic, in the waiting area, they can see that.
Yes, because there's a lot of everyone has a lot of time there.
Yeah. So so they can see it, and then they can be aware that this is what it is.
So what you just spoke about are the early signs.
Yes, they are the sign. They are the most common signs.
Okay.
So be fast is what the acronym is.
All right. You also said, you mentioned something called time is brain.
Yes.
Can you elaborate?
Brain cells can sustain decreased oxygen supply or absent oxygen supply only for specific time limit.
Which is your 4.5 hours?
Which is the 4.5 hours. So as the time approaches 4.5 hours, the brain cells are almost completely dead.
Okay.
So if a patient approaches at 1 hour and patient approaches at 3 hours, we can see that patient at third hour is already having more dead brain cells than
Okay.
the first hour. So that is what is brain, time is equal to brain. So earlier you intervene, the earlier the patient gets better. Simple as that.
So yes, strokes can be debilitating and life-threatening. They can occur without any warning. As Dr. Safal Shetty also said, risk is never really zero at any age, but with timely intervention, the illness is certainly treatable. Thank you so much, Dr. Safal Shetty, for being here with us today.
Thank you so much.
And thank you. This is Heather saying bye for now. Until next time, keep watching Prudent Media.